Hey, has it ever happened that when you were trying to bite into something like an apple or maybe something else which was slightly hard and you noticed bleeding from your gums and you were thinking like what is this all about? Or maybe even a simple act of brushing your teeth led to inflammation and bleeding from your gums. Then this is nothing but gum infection or gum inflammation, and in technical terms we call it as gingivitis or gum disease. If you too are suffering from this, then this video is for you. We're going to be talking all there is about gum infection and inflammation. And gum disease is something very nasty, not nice to have. If it's left untreated and if it goes unnoticed, then it can further progress and lead into something which is called as periodontitis, which is a slightly severe stage of gum disease. And this, mind you, might not be able to treat this easily at home, and certainly intervention by your dentist or your periodontist, who is your gum specialist, might be required, and this nasty situation is best avoided. So if you're looking to help yourself deal with gum disease at home and learn a few tips and tricks and get to know all about it, then this video is for you. Do watch it till the end. I'm going to be sharing a lot of tips that you can follow at home and try and help heal your gum disease. For those of you who are new to my channel, welcome. I'm Dr. Upasana Gosalia, founder and head dental surgeon at iSmile Dental Clinic, which is located in Mumbai. My channel is dedicated to addressing a lot of common health issues or even dental issues that a lot of us have. So don't forget to subscribe. We want to make sure that you're the best healthy version of yourself. And do watch out and look out for all the videos that are upcoming. Hit the subscribe button, press the bell icon to get regular updates and notifications. So let's start with the most obvious and first question. What is this gum disease? Gum disease is nothing but presence of infection in your gums. Gum disease and gum inflammation is the reason why you are so easily bleeding when something touches your gums. This luckily is reversible if you have noticed it or if you've started your remedies at an early stage. But now there are some basic symptoms which you can look out for yourself even without having to visit your dentist. So there are just a few tips that I want to share. First is swollen and spongy gums. With the presence of infection, inflammation is inevitable, and because of inflammation your gums look spongy and they look something like this. So this is one sign of gum inflammation. Check out for this. The second is bleeding on touching or on brushing. So even when you're trying to bite into something hard or say simple activities like brushing, that can also lead to bleeding. In healthy individuals, remember that those who do not have gum disease do not have any of this bleeding when they're trying to brush your teeth. Or, for example, you yourself, a few months ago, you might not have noticed that bleeding. But now, if you do, then that means there are some changes that have developed in your gums, and that is giving rise to the bleeding, which is the gum disease. So, bleeding is certainly a sign that you need to look out for. And the first spot of blood that you notice while you're spitting or when you're brushing calls for a visit to your dentist. The third sign that you can look out for is the presence of plaque and tartar. Plaque is nothing but this sticky substance which you find is always stuck onto surfaces of your teeth, maybe because of improper brushing techniques. And when this plaque is untreated and stays on your teeth for a very long period of time, months together, I would say, then it develops into something called as calculus or tartar. This is nothing but mineralized or calcified plaque, and this will further worsen the situation because it harbors a lot of dirt, bacteria, and germs. So this will increase your gum disease. And last, a lot of patients have also complained about the presence of bad breath or bad odor. This, remember, comes in from bacteria because gum disease and infection invites a lot of bacteria in your mouth. There's loads and loads of them, millions of them, and they produce dirty gases as a byproduct of their metabolism, like hydrogen sulfide, etc. And these will give rise to bad breath. So despite of repeated efforts, if people say that I'm brushing twice in a day, I'm using mouthwashes and whatnot, but my bad breath is just not going away. So that means there might be a deep-rooted cause for it. There is certainly some amount of gum disease present in your mouth that is untreated. You haven't yet probably noticed it. So this also could be one of the signs, and watch out for it. Now, this gets us to the next part or the next question, which is what is the reason for this gum disease and inflammation? If I were to classify the reasons broadly into categories, I would say there's basically, two of them. One being localized, or something which is present inside your mouth, close to your gums and teeth. That's the localized form of gum disease. And another could be a systemic meaning there's something wrong in your body, the presence of an underlying disease, or a systemic infection, or something which is actually manifesting and showing its symptoms in your mouth and teeth. So what are these localized issues or localized problems that you could have? The first is obviously presence of plaque and tartar in your mouth, which is, as I explained earlier in the video, one of the main reasons, I would say, for presence of gum disease and inflammation, because it invites bacteria. Plaque is fully loaded with germs and bacteria, which are playing the main role in giving you the gum disease. So that's one. Secondly, you could also be having some ill-fitting crown or denture, something which is abrading your gums for a long period of time, and that area could be further getting your gum disease. So that could be one. Or it could also be the presence of some deep cavities, especially the ones which are present between your teeth. These areas are, difficult to clean if there's a very big hole and a cavity there, and there's a lot of food lodgement happening repeatedly every day. So this could trigger your gum infection and inflammation as well. And obviously, the most important thing that goes without saying is your oral care regime. So you must brush twice in a day. You must use the toothpaste that has been recommended to you by your dentist for your particular maintenance therapy and phase. And if at all you've been asked to use an additional oral hygiene maintenance, like say the use of water flossers, then please do that as well. Do not skip out on that step. Flossing or water flossers are equally important. And lastly, and I would say again very important, is do not miss out on your dental cleaning sessions, because once in every 6 months is usually what we recommend. What happens here in these cleaning sessions is that we get rid of all the plaque and tartar buildup that has happened, and we do not let this, go and increase further, which can hamper your gum health. So we literally nip it in the bud. We do not let any disease progress further. And if you are regular and thorough in both your oral hygiene at home maintenance as well as your in clinic 6 monthly or maybe even annually, as your dentist recommends, if you're coming in for your regular teeth cleaning sessions, then I'm sure you can keep gum disease away forever. So that's all about the localized issues and the localized form of gum disease. But if you have something which is systemic and manifesting in your mouth, there can be many reasons for it. I'll quickly run you through a few of them. Firstly, it could be a vitamin deficiency, typically a vitamin C deficiency, which we call as scurvy. A lot of times our diet lacks enough amount of vitamin C. In such cases, gum diseases develop easily, and this is very easily treatable. All you need to do is incorporate extra vitamin C in your diet, and there's also chewable vitamin C tablets that are available freely over the counter. Secondly, in patients who are suffering from PCOD, so even in these women, we've seen that gum disease is present very often. I would say almost in every other woman who is suffering from PCOD. Obviously, this has something to do with your imbalanced hormonal levels, and sometimes also because of additional therapy and hormonal pills that you've been put on. But luckily, this is reversible. You're still in the reversible stage, and sometimes a little bit change in your therapy, or just managing your drug levels, dosage levels, can do the trick, and we can obviously reverse the situation for you. But yes, this also is one of the systemic manifestations. Thirdly, in patients who are suffering from high blood pressure, hypertension, and your doctor has put you on some drugs which you're new to, your body hasn't still gotten used to it, or sometimes it's not suiting you well enough. So in such patients also, we've seen presence of gum disease and inflammation. But luckily, this is also reversible. We could just change the drug for you, talk out with your physician about it, alter the dosage, or do something which can still get you back, and this is still in the reversible stage, so you don't need to worry much about it. Fourthly, Pregnancy, again, a situation wherein your hormones are going overboard, and this directly has a relationship with presence of inflammation in your body. So this will give rise to some amount of gum inflammation, but again it's reversible. So typically we see symptoms arising somewhere like in the second and the third trimesters. A lot of patients develop gum bleeding which was not there earlier, though they are maintaining excellent oral hygiene and therapy, but due to any internal hormonal imbalances this pops up. But once the baby is delivered and you're back to your routine and maintaining your good oral hygiene, then within a couple of months after the delivery your hormone levels also get back to normal, and your gum bleeding and inflammation will also get back on track. It will no longer be there. And lastly, one of the biggest factors in terms of a systemic manifestation would be a patient who's suffering from diabetes and high sugar levels. This has happened to us a lot of times, that patients were even unaware that they had high blood sugar levels and they came in, but because after managing them locally, giving them all their regular cleaning sessions, application gels, yet the gum inflammation and infection is not coming down. And that's when we put them through some blood tests, and we got to know that okay, these patients are suffering from high blood sugar levels. So something as simple as a dental checkup can help you gain so much insight on your overall and general health as well. Diabetes, as we all know, it has a lot of systemic manifestations. Patients are aware about these things, like okay, if you have diabetes, then maybe my kidneys could get easily affected, my eyesight could get easily affected, I have a higher risk of a heart disease. This information is very well known, but what all of us I think are slightly unaware of is that diabetes also has a very high or a huge effect on your oral health. And presence of high blood sugar levels means that you have higher chances of infection, and healing will not happen that easily in your body because of the presence of high sugar levels. So this in turn, it's like a vicious cycle. If you have high blood sugar, you're going to have gum inflammation, infection that could help and hamper you from getting your sugar levels down, and it's like a cycle. So to break this cycle, you have to treat your sugar levels, get them under control, and once they're under control, your dentist will put you on a proper maintenance therapy. You'll have to visit your dentist more number of times. It's not like you can just go in once in a year or twice in a year and just think that you're going to have great oral health. You may even have to go in more than that, say once every 3 or 4 months. And this will help you to mainly keep teeth diseases and gum diseases at bay. So now that we've understood so much about why this is happening, what is gum disease, what could be the underlying reasons, let's talk about a few simple things that you can do yourself at home if you're suffering from bleeding gums, and maybe just help you heal or tackle the bleeding gum situation for a little time until you pay a visit to your dentist and get to the root of it, right? The first thing that you can do is start some hot water gargles. Take a glass full of hot water. If you can add some salt to it, great, nothing like it. But if you can't, even plain water, plain hot water just works fine. This is a great combination. See, heat is basically like a anti-inflammatory, and salt, as we all know, is like an antiseptic. So both of these together play a great role in getting down your inflammation and infection levels. You need to hold this water in your mouth like a mouthwash. Just hold it for 10 to 15 seconds. Each gargle should be for at least 10 seconds, and then spit it out. You need to do a glass full of water at least 4 to 5 times in a day. This will surely help you and calm your gums down for a bit at least. Secondly, what you can also do is start yourself on some vitamin C therapy. Vitamin C is great for your gums, like I said earlier. Just start taking one tablet every day. Mornings would be the best. A simple course of just 2 weeks, 2 to 3 weeks, and you could definitely see difference in your gums. If your diet lacks vitamin C, then this thing is surely going to help you out. Also, what you can start doing is learn the right technique to brush. Start managing your oral maintenance or at home maintenance a little bit better. Learn the right technique. I have made a short video on what is the right way to brush. I'll be linking it down in the description box. Do have a look at it. And what you can do is, if you think you cannot master this technique, or maybe it's still difficult for you, then you can also switch to some added or additional aids, like say electric motorized toothbrushes, or you could invest in some water flossers. These are great aids, in the long run, to keep cavities and gum diseases away. So do this, get serious about your oral health. There is no replacement to twice a day brushing. And do not think that because I'm using mouthwashes, it's okay to get away with once a day brushing. No, it's not. Get serious about it. Start with your proper regime, follow it, and you will surely see a difference in your plaque tartar buildup. And that will in turn help with giving you lesser and lesser chances of gum disease. Lastly, you can also use some form of medicated mouthwashes or maybe a gel. So in terms of mouthwash, what we have seen is chlorhexidine based mouthwashes easily available over the counter. So you can try and start your therapy with that as well. Just one thing to keep in mind is, do not mix it with your brushing. Always the best time I like to recommend is after your meals, like after your major meals, your breakfast, lunch, and dinner is the time when you should be using the mouthwash and not after brushing. And if you're okay with direct, you can use it direct or diluted as per your choice. But chlorhexidine based mouthwashes give generalized good result. Plus, in the long term, they do not have any harmful effects on your taste buds, etc. The taste also, of these mouthwashes as compared to something which has alcohol and everything present is milder. So look out for something which has chlorhexidine and does not have alcohol. That should certainly work for you, at least to a certain extent, if your plaque tartar levels are within control. And this will help you reverse the situation. Also, in the form of medicated ointments, you could try using something called as a metrogel based ointment. Again, you can get it over the counter. It's just like a gel application. You need to take a few drops, apply it all over your gums after you have brushed your teeth and taken away all the dirt and the food debris. After brushing and scrubbing, you need to apply this gel. Leave it on for 10 to 15 minutes on your mouth. In the meantime, if you feel like spitting, just keep spitting out that gel. Though it's medicated, so technically, even if you ingest it, it's not really going to be harmful. It's basically, in layman's term, if I were to explain, it's like an antibiotic for your gums. So I really like to recommend Metrogel based ointments and gels to my patients, because it's like direct therapy. You're treating directly at the place where the infection is present. So you can get this, try this, do it for 2 weeks. Even once in a day at night is great. But please remember to do it after brushing. You cannot have dirt and plaque on your teeth and still keep applying the Metrogel and expect it to work. So you need to scrub and clean before, and then followed by topping it up with this gel application. So this will work for you. Okay, so that's all I wanted to share about gum disease, bleeding gums. So let me know in the comments below what you thought about this. Did any of these 5 tips that I've shared help you out or no? I hope that none of you have gum disease, or at least nothing that progresses to a very nasty stage. And these things will surely help you in the long run. But do not let this be the only treatment choice. Please do remember, these can be additional aids or things like a supportive therapy. Visit your dentist for your regular cleaning sessions, and do this as your maintenance and supportive therapy. And I'm sure that you're going to have beautiful pink, healthy gums and a beautiful smile. And like I say always, stay healthy and keep smiling.